We're back at micro lecture number 7, which means we're about to start the 7th simulation. We're in the home stretch, this one and one more, and you guys are done for the day. You've done a lot of hard work. You've worked really hard understanding these concepts, building concept or care plans, going through some questions. You guys have worked really hard, really, really hard, and I'm super proud of you. So micro lection number 7 is going to be about blood transfusion reactions. And before I can move on. Okay, so what's happening and why does it matter? So transfusion is a high risk therapy. Lots of things can happen. And a reaction can happen within minutes. So verification of that unit and vigilance during it are the safeguards that protect the patient. So look at blood products as a medication. Okay. Blood products are a medication, but blood products are easily, can blood products go right into your bloodstream and they could immediately cause an immune reaction if they're not the right kind. So that's why we do the blood typing, right? So we want to make sure that we verify that we're giving the right blood. And that we have hypervigilance when we're administering this blood and make sure that everything is right. But even then, a transfusion reaction can happen. And that is completely fine. You did nothing wrong as long as it's the right product. But it's your identification that there's a problem that's going to save your patient. A transfusion reaction can easily move the patient into DIC, and that's really high mortality rate. So you want to make sure that you are constantly reassessing these patients to make sure that nothing bad happens. So most serious reactions are preventable with correct verification and are survivable with fast recognition, but knowing the first action is what protects the patient. So knowing how to verify that is what protects the patient, but then also assessing. In the first 15 minutes, stay with the patient, look for those signs and symptoms. And then you'll be golden with this. So our assessment, we want to have concepts of baseline and early vitals. So you want to get baseline vitals before you give the unit, and then you want to get those vitals again at 15 minutes, and then you want to do vitals at the end. We want to make sure that we don't have any issues. We want to stay with the patient and recognize the signs of reaction. Signs of reaction are going to be like back pain, or maybe the temperature rises, or maybe the blood pressure changes. You want to look for all those things. So at the first sign of a reaction, the first action is to stop the transfusion. We know that we're giving a medication that is causing an allergic reaction. We don't want to keep giving it. Obviously, we have an underlying problem where the patient needs blood, but an allergic reaction is the priority. So we're going to stop the blood immediately. We're not going to flush it in either. We're going to pull everything out. Okay. We'll leave the IV line in because a lot of times that's our only access, but you're going to pull all the tubing. Your interventions before hanging are going to be nurse verification. You want to maintain IV access with saline, and you want to notify the right teams, right? And then pharmacology, our concept of matching treatment to the type of reaction, whether it's supportive, antihistamine, or emergency medications. And then your verification. So again, the concepts connect. We want to verify, make sure that we have the right unit to the right patient to prevent that hemolysis. Our vigilance is early vitals, catch a reaction as it begins, and then we can stop it and help the patient feel a little bit more comfortable right away. Our first action when we have a reaction is to stop that transfusion, then reassess our patient. And type, we want to understand the kind of reaction because it's going to guide the treatment. All right, so your reminders are nurse verification before the unit is hung every time. You want to stay with the patient for the first 15 minutes of a transfusion. If a reaction is suspected, you want to stop first, keep the line open with saline, but you're going to attach your saline away from the blood tubing. And then run blood products with normal saline only. All right, go make me proud. with your transfusion reaction simulation, and then come back here for your last one.